Welcome to another episode of the Helpful Pharmacist Podcast. My name is Chris. I'm the Helpful Pharmacist, and today we're going to talk about all things health. Today we have another episode along our series of diabetes. So we're taking a step back, and we're going to talk about one specific complication of diabetes that I think is a lot more than a complication. It's also an issue that another group of patients experiences, so it really is applicable to almost everybody out there, which is why we're talking about it today. Definitely really excited about it, so let's get into it. So today, the complication of diabetes we're going to be talking about is cardiovascular disease. And why I also say that it's more than just a complication is that cardiovascular disease by itself is the number one cause of death in the United States, whether you're diabetic or not. So odds are, if you're someone out there watching this, this is going to be the number one health concern you're facing or you should be facing. We want to increase people's understanding so they can really see and feel what's going on with their health and their life. And when they have the opportunity to make those better decisions, they understand the why. So I want to start today's episode off with some simple questions, and I want you to think about these as we go forward in the talk today. So the first one is, how often do you exercise for more than 20 minutes? Second one is going to be, how often do you measure your blood pressure? And the third one is going to be, do you know what your LDL is, or do you know what LDL is? Again, LDL is the bad type of cholesterol. We're going to talk about that later. But again, my point is that these are very simple questions and very simple things you can do to help change and empower your life. And in my experience, especially lately, when I'm asking these questions, not a lot of people are saying yes to all of them. And so again, the goal today is to help you understand why you absolutely need to say yes to these three questions and to give you some background as to what may happen if you don't answer yes to these questions or what risks you're taking or adding into your life. And again, I also want to say that those three things I just mentioned are basically free. You can go outside and you can walk for free. Blood pressure monitor costs about $40, but once you have it, it's free. And typically, if you have insurance, they're going to cover an LDL lab. Not only are these three things so impactful for your health and your future, but they have little to no cost. So if healthcare and getting sick is so expensive, we need to learn to understand what are the simple and effective things we can do upfront in advance to help minimize that. These are great examples. They'll change your life and have all these positive things to come. Cardiovascular disease is the number one cause of death in the United States, unfortunately. So there's about 3.5 million reported deaths a year in the United States, and about 700,000 of those are attributed to cardiovascular disease directly, which makes it the number one cause. But what I think is, and that's a pretty common fact, most people know that. But the one thing that I think is really interesting, that I think is a really unique and powerful way to look at it, is if we go onto the CDC, which is a US government information site, and we look at the top 10 causes of death listed. So these are the things that cause people to die. And I'll just go through the list real quick. The ones I have would be things like cancer, stroke, Alzheimer's disease, diabetes, kidney disease, liver disease, and COVID. I believe those are 8 or 9 of the top 10 causes. There was one that got left out. If you look at those, it turns out every single one of those that I just mentioned, cardiovascular disease increases the risk for it. That's the interesting concept or perspective for today's talk, is that not only is cardiovascular disease the number one cause of death, which a lot of people are aware of, but it actually increases the risk of all the other most common causes of death. And I think that's a unique way of looking at it. A lot of patients I talk to, it's like, oh, I don't need to measure my blood pressure, I'm not worried about it. And I think they can rationalize it as is that high blood pressure isn't that serious, it's not that big of an issue, it's readily able to be fixed or reversed. So if it was a problem, I'll just take a pill and it'll go away. And it doesn't really even work like that to begin with. But I think what's interesting now is that we can teach people that not only is high blood pressure a major risk factor for cardiovascular disease, which in itself is an issue, but it actually becomes a risk factor for almost every other disease. So it's not just one problem you're increasing the risk of, it's 9, 10, 15, 20 problems you're increasing the risk of. And the goal is that when you help people understand it that way, it changes their involvement or their engagement, and then suddenly they feel more of a need, more of a motivation, they see more of a value or a benefit of doing these behaviors. Again, I also want to talk about hypertension real quick, because hypertension typically is going to be the driving risk factor for cardiovascular disease, causing other issues. Typically, it's hypertension, high blood pressure, and atherosclerosis, which is a fancy word for plaque buildup in your arteries. You got junk in your arteries. But generally speaking, when you look at the literature, hypertension is probably more of a cause or is more of a cause than the plaque buildup. And so, again, taking another step back, talking about cardiovascular disease being the number one cause of death in the United States, driving all the other main causes of it. Yet when you go and you ask people to measure their blood pressure, oftentimes they say no, or more often than not, they say no. So that's kind of like the setting we're going here. So the next fact is that about half of all of the people in the United States with have high blood pressure don't know it. So I think that's another really interesting layer to the onion, is that not only are people not monitoring it, and not only is it this huge issue, but the people who have it, they don't know. So imagine having something that increases the risk for basically every major disease, but not knowing you have it and not being able to prevent it or take action sooner rather than later. I think that's a really, I would think sad, but also powerful concept, because there's so much you could be doing now that's simple and easy. Diet, exercise, losing weight, don't smoke, don't drink, manage your stress. If you do those things, there's a very good chance to get your blood pressure under control. It's really simple and easy. Versus if you get a kidney issue, a heart issue, if you become diabetic or get diabetic complications, you get cognitive issues, the ability to control, fix, and reverse those is much less. So again, part of what I educate people on is let's start with the simple and easy things that are effective and get those taken away and squared away. Because if we don't do those, everything else is going to be harder. So let's make the work as easy as possible. Only 20% of people who have high blood pressure that's been diagnosed are controlled. So the number one cause of death, half the people who have it don't know it. And within the half that do know they have it, only 20% of those people are actually controlled. So from a very general standpoint, for every 10 people who have hypertension, maybe only 1 or 2 or 3 of them are properly controlled. And again, not to repeat myself, but it's the number one cause of death, and it increases the risk for everything else. So I think it really sets for a very shocking kind of thought process here, is that we're not doing our job. Our job is to help people. Our job is to make our lives better. Yet the number one thing that affects that we're not working on. That's what we're talking about today. And so that kind of ties into the next concept, is that there's a lot of things that go into life, that go into health, decisions, choices, whatever we want to call it. And what I see a lot of times is when people come to me and they ask me a question, and I look at them and I do an assessment, I get an idea of what's going on, what my concerns are, and then they ask me their question, a lot of times they're not the same. So I'm thinking, again, hypertension, obesity, diabetes, lack of exercise, things like that. And they're more worried about this little random thing that they read about on the internet over there, and that's where all their time and energy is going to. So just an easy example is I get a lot of questions about statins, cholesterol medications, simvastatin, rosuvastatin, those types of drugs. And people don't want to take them because they're worried about side effects that they read about. And they read about people getting memory issues and things like that. Memory is the big one with statins. But when you look into the literature, there's very little to no evidence to suggest that. And I think based off the literature, you can say it's probably like a 1 in 100 or a 1 in 500 or a 1 in 1,000 type risk. I think it's probably around a 1 in 500 type risk. And so because of a 1 in 1,500 risk, people are not taking a statin. Well, the reason why this is a great example is that cardiovascular disease is the leading cause of death, and statins are the second or third most important thing to prevent that. So on one hand, you have a 1 in 1,000 risk, and on the other hand, you have a 1 in 10 risk. And you're more fixated on that 1 in 1,000 risk than you are on that 1 in 10 risk. And so I think that, again, really illustrates the lack of alignment with people understanding their health, their decisions, and fitting into the healthcare system, because that statin is going to reduce the risk of a heart attack or a stroke, which is basically the number one cause of death. But you're more worried about having a 5 or 10% reduction in your memory, which no study really confirms or proves exists, that will take years and years and decades to occur in the future. You'd rather mitigate or prevent that and expose yourself to this 1 in 5 or 1 in 10 chance. Basically, if there's one thing you remember, it's basically this last 5 minutes. Everything else is going to build off of that, but that's the big takeaway. And like I said, when you look at people's behavior, you just don't see this. They are not taking this, which is going to clearly help them, and the reason they have it for it is not really informed or even that accurate. I think that's a big takeaway. A lot of people I talk to, they don't measure their blood pressure. Even people who have a high risk for it, they don't measure their blood pressure. And I also meet people who have really high blood pressure who aren't concerned by it. And that's also another example of not fully understanding, is that your blood pressure is a huge risk factor. I mean, the odds of something happening in the next couple of months is pretty high. And these are life-changing events and not in a good way, but you're not really concerned with it, and you're definitely not doing anything to help prevent it or mitigate it. And so if you've watched any of our other videos, the term I'm always mentioning whenever I can is health literacy, which is really a fancy word for what we're just talking about. Health literacy is the ability to understand, apply, and make decisions for your health. And so again, I think this illustrates it perfectly. The number one cause of death people aren't worried about. The number one cause of death people aren't actively trying to prevent. And the number one cause of death has lots of little things that are very simple and easy to do, but people don't want to do them. And there's really no good reason why. So that's why we're talking about it today. The idea that when we're making health changes, sometimes it's not easy. And I understand that, definitely. And when I work with all the patients, that's definitely always a huge part of the conversation. It's not fun to change your diet. It's not fun to change your lifestyle. If someone comes along and tells you you need to do this, but they don't tell you why, that's even less fun. So my reason for saying this is that part of what we build into with all of our education is helping the patient understand their why. Why are you doing this? You're doing this because you're at risk for having a heart attack or a stroke. You're doing this because you don't want to get dementia in the future. You're doing this because you're worried about getting cancer or kidney disease or liver disease, whatever it may be. And again, hypertension or blood pressure increases the risk for all of those things. So if people don't have that why, it won't make sense. And so some examples I want to share real quick about why it's so important is, first of all, following laws. There's a lot of laws that people may not want to follow, but we follow them because we understand the why. We're going to go to jail if we don't. Same thing with paying taxes. We don't want to pay taxes, but we understand the why. We're going to go to jail if we don't. So there's a lot of examples where people on a daily, weekly, monthly, annual basis, whatever it may be, we're doing things we don't want to do because we have a why and we understand the why. And that's what allows us to overcome those barriers. Health is absolutely no different. So I think the second biggest takeaway from today's talk is that if you don't have a why, if you don't have a reason for why you're doing or making a change, you're not going to be successful probably. So that's always got to be a first part of that process. And in terms of cardiovascular disease and talking about the why, some whys can be more energy, you can have more productivity, you can have a better quality of life. And then the flip side is imagine being sick on the couch for 10 or 20 years, not be able to exercise, play with your grandchildren, doing the things you love doing because you have a heart issue, you have a kidney issue. So that's the why. The why is we want to have a better future and we want to enjoy life as much as we can. So just real quickly, we're going to go through the cardiovascular system to make sure we're on the same page here. When I say cardiovascular system, pretty much talking about the heart, the blood vessels, and the blood inside the vessels. The analogies I want to use here is the heart is basically like the engine, so it pumps and it does the work. The blood vessels are basically the roads. This is how things transport or move through the body, just like a road or a freeway. And the blood, I want to call the trunk or the shopping cart, so it's where things get stored. So the blood is basically the cart that all the items get stored in, and then we transport them in the cart on the roads. And then to walk through that process once, so you breathe in air through your nose or your mouth, goes into your lungs. Once it's in your lungs, it's absorbed in the blood. From the blood, it goes to the heart pumps it out into the blood vessels, and it gets distributed to the rest of the body. Once it eventually reaches the end goal, which is usually some type of a cell, tissue, like a muscle or an organ or a nerve, whatever it may be, the nutrients, primarily oxygen in this case, are released. And then the CO2, which is the waste product, goes back into the blood, and the blood basically comes back to the heart and is recycled. So it is a closed loop system, and it definitely goes all the way back through. Again, I want to talk about oxygen real quick here because that's the main thing we're transporting. The oxygen is how the body makes energy. So you take sugar plus oxygen, you get ATP. ATP is the currency of energy for the body. So one of the main reasons why so many health issues are affected by cardiovascular disease is because the cardiovascular system is how you get oxygen. Without oxygen, nothing works properly. I think of oxygen in that case as basically like $20 bills. It's basically good for anything. And when you have that oxygen, anything's possible. Versus when you don't, bad things happen. I do also want to throw in a crazy concept here. I looked this up multiple places. It's pretty mind-blowing. So I'm 6 feet tall, roughly, I wish. And yet I have 60,000 miles of blood vessels in my body. So I didn't do the math, but I think 60,000 miles is something like 30 million feet. So even though I'm 6 feet tall or close to it, I have 30 million feet of blood vessels in my body, which is just mind-boggling. It's hard to imagine 30 million of anything being in my body. Just to give you an example of how complex and how all over the body the circulation system is, I think that's a really great fact. Again, we want to talk about real quick what the circulation system does. So basically it transports the nutrients. So these can be things like oxygen, sugar, protein, fats, but also things like immune system cells, other nutrients the body needs to basically make energy, repair, grow, and heal itself when it gets sick. And so I think why this is also important is that there's a lot going on in the blood vessels. I think of them as almost like the front line of your body, because if the blood vessels are the highway, Obviously, a lot goes on the highway. The highway is basically the front line. And so I think it begins to help us understand why the blood vessels are so prone to damage or risk. There's a lot going on. They have to carry all the food, including the fat. So if you have a poor diet, the blood vessels are going to be highly exposed to the consequences of that. All the immune system is typically taking place in the vessels. And unfortunately, when the immune system doesn't work properly, it causes things like inflammation and damage. So it's localized to the blood vessels. And also things like free radicals are also highly concentrated in the blood vessels because that's where a lot of things are happening. So not only are a lot of good things happening in the blood vessels, which is good, but a lot of bad things are happening in the blood vessels, which is bad. And that's why we have to be really mindful and take good care of them. Again, we're transporting all the nutrients and all the resources the body needs through the vessels. When the body or the cells don't have what they need, bad things happen. So some examples would be if you don't get food, you don't feel good. If you're sick and you can't go to the doctor, you typically get worse. The blood basically provides all these things for the cells. So when the circulation's impaired, the cells are going to starve. In terms of the heart itself, the heart works 24/7. So if you think working 40 hours a week is tough enough, imagine being the heart, you're working 24/7. The heart beats on average about 100,000 times a day. So imagine doing some task 100,000 times a day, every single day for your entire life. That definitely will wear and tear on you. The blood vessels are pressurized because obviously we have blood pressure. And so imagine you're a structure and there's something constantly pushing on you. It's definitely going to wear on you and cause a toll. So just the nature of these vessels themselves, there's a lot going on that is hard for them to overcome. And when we don't diet and exercise properly, basically the body breaks down and it succumbs to these damages. Again, we mentioned that oxygen is really important. The body, again, converts glucose into ATP. And when you don't have oxygen, you can only make 2 units of ATP for 1 molecule of glucose. But when you have oxygen, you can make 32 units of ATP. So when you have oxygen present, the cells make 16 times more energy. Again, to illustrate why oxygen is so important. And if the circulation system is how the cells get oxygen, again, we can intuitively understand the importance of that there. And the analogy I have here is that it's like driving a 700 horsepower car versus a 100 horsepower car. I think we all understand the differences in which one's going to be faster and perform better. I think we all hope that our body would be a 700 horsepower car, not a 100 horsepower car. So that's basically in a nutshell what the cardiovascular system does, is it pulls in all the resources, pulls out all the waste products. And those are going to be things like glucose, which makes energy, oxygen, which makes energy, and the immune system. We're going to real quickly, again, take that step further and explain why these issues cause a disease. So the first one is going to be hypertension. So imagine the pressure being excess or constantly elevated. So if you have a car, you have like a window or whatever, be some examples. If you push on that too hard, what happens? It breaks. Your blood vessels are no different. So then it becomes pretty intuitive that if our blood vessels are exposed to a pressure that's excessive, it causes premature wear and tear damage, which obviously we don't want. And again, we talked about how we have, big blood vessels in our heart, small blood vessels where the actual exchange occurs. So both microvasculature, the small vessels, and the macrovascular can be affected by this. So it's all the vessels can be affected. And oftentimes it blows out or damages those little ones first. So that's where a lot of diabetic neuropathies come from, actually, is that patient has an issue with their vasculature system, and that causes a reduction in nutrients to be sent to the nerves, and the nerves die, and that causes the neuropathy issue. The second issue of why cardiovascular disease can be such a problem is that when those blood vessels aren't healthy, other things occur. So again, we have a blood vessel in the lining. It's called the endothelial lining, and that's where all the magic happens. What happens is when the pressure is too high, the endothelial lining gets damaged, it becomes inflamed, and then things get stuck to it. So examples of things that can get stuck to it are the fats or lipids in our diet or our immune cells. They can basically form together something that's called a foam cell. So it's basically a block of junk on the side of the artery. And then the immune system sees that, and the immune system gets involved, and it basically grows it and gets larger, and it begins to block blood flow. So that's an example of atherosclerosis. And now we've talked about how the circulation delivers all the nutrients, and we've talked about what happens when we don't have enough oxygen. We can begin to intuitively understand that if we're blocking the blood flow, nothing good's going to happen. So those are 2 examples of why hypertension and atherosclerosis are the 2 main contributing factors of cardiovascular disease, and tying those into the idea of why it's such a problem. I hope you can kind of have a foundation. You have a little bit of a why. If I don't have low blood pressure, it damages my vessels get damaged, I don't get oxygen to my cells. And when I don't get oxygen to my cells, my tissues basically starve to death, which obviously isn't good. So now we're going to start talking about how we can prevent this, because obviously that's the goal. And we talked about earlier that there's a lot of things you can do that are simple, easy, cheap, and free to reduce the risk of this happening or prevent it from happening. So that's the good takeaway here. Like we already said, the number one goal is to reduce the excessive pressure in the vessels because that pressure is what causes most of the problems. One of the things I want to introduce here as to why I think people aren't measuring their blood pressure is that oftentimes in marketing and psychology, there's a correlation or a concept that says the more something costs, the more value we perceive for it. So part of the reason why a Ferrari is a Ferrari is because it's so expensive. Part of the reason why a Rolex is a Rolex is it's so expensive. If those things didn't cost as much, we may not put them on such high pedestal or value. So I think that can be applied to blood pressure because measuring your blood pressure is basically free. So I think that really throws people off. They think that because it's free, it must not have value. If it doesn't have value, it's not worth my time or for me to do it. And again, the easiest way to prevent a blood pressure issue, measure it at home. It's nearly free. The sensor or the pump, the blood pressure monitor costs like $40. Recommend Omron is the brand. Omron 3 is a great model. They're about $40. They're very accurate. Once you buy it, there's no cost. It takes 45 seconds and it can literally change your life. So think about that. The number one cause of death, if you buy a $40 sensor and you take 1 minute once a week or once a month, can change or save your life. I challenge you to think of anything else in this entire world that for $40, you can prevent the number one cause of death or save or change your life. There isn't one. So again, I'm trying to help people understand why they have to measure blood pressure and why there's absolutely no reason not to do it. To give some statistics there, so we're talking about blood pressure. So the top number is the systolic. That's when the heart contracts. It's the highest pressure. The bottom number is the diastolic. That's when the heart relaxes. And that's why there's a range. And that's why the systolic is higher than the diastolic. Typically, we talk about the systolic, the top number, because that's what we're most worried about. The highest high of the pressure is more damaging than the lower one, generally speaking. And to give some examples, the gold standard for blood pressure is still 120/80, so we've heard that before. The current guideline is 130/80, so the guideline recommends everyone be at or below 130/80. And typically, once you're at 140/90 or higher, you're going to be diagnosed with hypertension. Typically, anything over 150 is concerning. And once you get into like the 160s, there's a real risk of a heart attack or stroke happening, especially over 170. So anyone with a blood pressure over 170, from a provider standpoint, we're highly concerned about heart attacks and strokes happening because when the pressure gets that high, it changes the way the blood flows. It makes it more prone to clotting and obstructions and occlusions and things like that. Typically, blood pressure is going to be between 110 and 140, ideally it's around 120. For every 10 points the top number increases, so if we went from 120 to 130 or 130 to 140, we're going to basically increase the risk of a stroke by about 50%. So imagine that. If someone's like, why do I need to care if my blood pressure is 140 or 130? Well, if your blood pressure goes from 140 to 130, you're going to reduce the risk of a stroke by about 40%. And there's 140,000 deaths a year in the United States from strokes. It's like the number 8 cause of death. So just that 10-point difference on your blood pressure can reduce the number 7 cause of death by 40%. It's a huge, huge change. The next example is that for every 20 points the top number increases, so if you went from 120 to 140, you're going to double the risk of cardiovascular disease, which again is the number 1 cause of death and basically increases every other major cause of death. 20 points, doubles it, just to give you an example of why it's so important. And then also another example that's really commonly talked about right now, as it should be, is cognitive disease, things like dementia and Alzheimer's. There's general correlation that shows that for every 10 points the top number increases, so if your blood pressure goes from 130 to 140 for the systolic, you could see anywhere from a 10 to 30% increased risk of getting a dementia or Alzheimer's. And Alzheimer's, I believe, was the number 5 or number 6 cause of death in the United States. So again, there's some very direct correlations between blood pressure and these issues which you want to avoid. And even a very minimal change of 10 or 20 points can be life-changing. Basically, if you go from 140 to 120, you're looking at a 10 to 50% reduction in 5 of the 10 most common causes of death. Again, reducing the risk of 5 of the 10 most common causes of death, if not more than that. It's basically 8 of the 9 on the top 10 of the list. So it's like a huge, huge difference. There's nothing else you're going to do with your health that's going to have more of a benefit. People ask me, how often should I measure my blood pressure? So I personally educate people that anyone over 30 should start measuring their blood pressure once a month at home. That's because this can happen early on in life, and you're going to want to catch as early as possible. Once you get to 50, I recommend you measure it once a week at home because that's where the risks start happening. And for anyone that has other health issues, so if you have a kidney issue, you have obviously a heart issue, a lung issue, whatever it may be, diabetes, I start saying 2 or 3 times a week. And if you have a moderate or greater heart issue or any real issue, I think 3 times a week is important because like we said, high blood pressure is typically driving most of the worsening or the severity increase of these diseases. People ask me, when should I measure it? So the simple answer for me is be consistent. The reason why I say that is it is some variation throughout the day. It's going to be a little bit lower in the morning, a little bit higher in the evening. So if you measure in the morning and you measure in the evening, kind of an apples to oranges type comparison. So if you measure at the same time each day, it'll always be apples to apples, oranges to oranges. I think that's the easiest way to do it. I also get a lot of patients that ask me, how do I know if my monitor is accurate or I have more than one monitor and they have different readings? So a good recommendation is next time you go to your doctor, bring your monitor with you, have them measure it with their equipment and then measure it with your equipment and compare it, and it allows you to calibrate it. Once the systolic gets to be about 160 or the diastolic, the bottom number gets to be 100 or higher, we're seriously concerned. It's definitely the time to make as many lifestyle modifications as you can, which again are increasing your exercise, losing weight, changing your diet, stop smoking, stop drinking, but mainly diet, exercise, and stress. Those are the big ones, and smoking too. It's time to make it happen. Like you waited too long, you've gotten to a really serious place, you've really increased the risk. So again, if 20 points of systolic doubles the risk and you went from 120 to 160, you're potentially looking at a 3 to 5-fold increased risk for the number one cause of death. That's a really big correlation. I also want to mention too, if you're someone out there who has blood pressure over 160 and you're having a really hard time with it, make sure you're on a medication called clonidine. It's taken PRN, which means as needed. And so if you measure your blood pressure at home and it's too high, you can take the clonidine tablet and it's going to lower the blood pressure and make it a little bit safer. Next question I always get is, how do you measure your blood pressure? Some of the common things we're going to talk about is you don't want to eat or drink 30 minutes before because that'll throw it off. That's the first one. The next one is you want to make sure you go to the bathroom beforehand or empty your bladder. So make sure you do that. The next one is you want to sit in a comfortable chair with your back supported against the back, your feet flat on the ground, and don't cross your legs. If you cross your legs, it throws off the blood pressure. When you're actually measuring it, you want to put your arm on the desk or somewhere about waist height. If your arm's up here or your arm's down there, it's going to throw it off. Again, be relaxed. And you also want to make sure the cuff is tight but not too tight because that can also throw it off. So what I like to do is I'll put 2 fingers between my arm and the cuff. If I can fit 2 fingers in there, I think that's good. If I can put my whole hand in there, it's too loose. If I can't put 1 finger in there, it's too tight. So that's personally how I kind of measure if it's too tight or too loose, because again, that will throw the reading off. And then also, you don't want to talk while you're measuring, and that can throw it off. So what I always tell patients is the same thing every single time. Keep your blood pressure monitor where you watch TV in the evening. You're already on the couch, you're sitting there, you're nice and relaxed, you haven't got up for 10 or 20 minutes. You just bend over, pick up your device, put it on the table, put your strap on, push the button, just nice, calm, and relax for 30 seconds. You get your reading and you're done. So it literally takes a minute. And if you keep it where you watch TV, there's really no excuse. You do not want to buy the monitor that goes on your wrist. Those are not accurate. We definitely don't want to see those. You only want to buy the one that has the cuff that goes around your bicep. Also, real quick, want to go through some symptoms of high blood pressure so we're all aware and monitoring for these things. Because again, like we said, half the people who have it don't know it, and only 1 out of 5 who have it controlled. So most people who have this issue either don't know about it or aren't controlling it. It can significantly increase the risk of a heart attack or a stroke, especially when it's acutely high. So I want to make sure people know the symptoms of that. So we're looking for things like a really bad headache, chest pain, kind of feeling lightheaded, dizzy, or confused, maybe a blurred vision issue, so things just kind of don't look very clear. Again, confusion, and also maybe feeling a little bit of a palpitation, so the heart's just kind of beating funny. For me, the ones that I would point out to a patient are definitely headache, definitely chest pains, definitely feeling fatigue, dizzy, lethargic, kind of impaired or blurry vision, and just you don't feel well. Like it's like, you know, when you get sick, you have like the flu and like people are talking and it's like you can't understand them, or it sounds like they're talking a million miles an hour. It's going to be similar to that. If that occurs, 100% measure your blood pressure. And basically, if your blood pressure is 170 over 105 or 110 or higher, just go to the ER immediately. There's really no reason to take that chance. Also want to go over the symptoms of a heart attack real quick because we are talking about cardiovascular disease, so people are aware of this. Why this matters is 1 out of every 4 people who has a heart attack don't know it. So again, a lot of people are just happy they're not catching it. So similar, chest pain, pressure, discomfort, especially in the neck, the jaw, and radiating down the arm. That's going to be the classic hallmark symptom. You may feel suddenly out of breath, just completely winded. Some people have nausea, vomiting, or heartburn issues. So if you have a really intense burning sensation right here, that could be another sign. Some people will get kind of sweaty or clammy, so very pale looking with the moisture on our skin, like when we're sick. And again, feeling lightheaded or dizzy. So I think the big one is the jaw pain, the radiating pain, and the heartburn. Those most commonly, when I read the literature, are the ones that are going to be the symptoms. You need to call 911 or get in the car and go to the hospital as soon as possible if that's the case. Also want to include the symptoms of stroke. Heart attack and stroke are the 2 main issues with cardiovascular disease. There's about, I believe it's 700,000 heart attacks a year and 800,000 strokes here in the United States. So between heart attacks and strokes, there's over 1.5 million of those every single year. And about 70% of those happen to someone for the first time. So definitely really important to be mindful of the symptoms, especially for stroke, because with a stroke, you need to get to the hospital within 4 hours to have the best outcomes. There are certain medications that can basically undo the blockage, which is what causes a stroke. A stroke is when you have an occlusion or a block in a blood vessel, and it cuts the blood flow off. They can administer a medication to basically bust open that occlusion and return the blood flow oftentimes. But if it's been more than 4 hours since the stroke was thought to occur, they don't do that, which is why getting in the hospital as soon as possible is what matters, which is why the little acronym they use for the symptoms of stroke is BFAST. So B is for balance. So if you're unstable, you're kind of dizzy, having trouble walking, that could be a symptom. Eyes is a big one. So your eyes maybe don't focus the same, your eyes drooping, or your vision's really impaired, or you lose your vision. That can be a symptom of a stroke. Another big one is a facial droop. So again, the face is not even, the muscles are no longer innervated, so they relax. So you may not notice an evenness in the face, especially in the mouth, or when someone's talking, their lips aren't moving symmetrically. That can be a really common sign. Having weakness or numbness in your arms or your limbs is another sign. So if suddenly you can't move your hand, you can't contract your hand, you can't pick something up, that could be a sign. Speech is another really big one. So people are just kind of mumbling or blurring all their words together. They sound strange, that could be an issue. Or if the patient can't understand what you're saying anymore, so you're talking to them, but they can't follow along. That can also be a symptom. So again, the reason why the acronym is BFAST is getting to the hospital as soon as possible is the most important thing. And unfortunately, a lot of people don't know the signs and symptoms, and so they either miss them or they're delayed. I believe it's 1 in 5 people who has a stroke doesn't know it. So again, for both strokes and heart attacks, a lot of people who have them don't know it. So as you get older, your arteries will actually harden, and that will increase your blood pressure because they can't flex when the pressure changes. Likely that as you get older, your blood pressure is going to increase no matter what you do, which is why we all have to be proactive with diet, exercise, weight management, stopping smoking and stopping drinking excess amounts of alcohol, because everyone's susceptible. BMI, like I said, is another really big one. So if you have too much weight, the reason why that matters is that all of those cells need energy through circulation, like we said. And as we gain weight, we gain cells, and that's more cells the circulation system has to take care of. So it's more work for the heart. Things like sedentary lifestyle, again, play a role. The example here is that when we don't exercise, our vessels get stiffer, which we just talked about increases the blood pressure. And when we don't exercise, it increases our heart rate. Because when we exercise, it works out the heart muscles, it makes them more efficient, it makes it easier for them to do their job. They beat less because they're more efficient. So when we don't exercise, we have to basically increase the heart rate, which puts more strain on the heart. And the heart is already weak, they can't handle it, it causes problems. Diet can play a role. So especially things like sodium can increase the blood pressure, eating processed foods. So I talked about earlier how about the lining of the blood vessels is where a lot of problems happen. When you smoke especially or drink alcohol, it can damage that part of the blood vessel and make it more susceptible. And we already talked about how they're very susceptible in general. So definitely not something we want to make worse. And I also want to include sleep apnea, which is something that gets really left out. So when we look at the statistics, we see anywhere from a 30% to 300% increased risk of getting cardiovascular disease when you have sleep apnea. So it turns out sleep apnea puts a lot of pressure on the heart. There are about 6 million people in the United States who have been diagnosed with sleep apnea issues, but potentially as many as 25 million other people who have it who don't know it. So again, common theme here is a lot of people have these issues, they don't know it, and it's basically delaying their ability to treat it, which is going to increase the severity of the complications and the problems in the future, make it harder to fix. So again, that's part of the why. The why we're doing this now is we understand if we don't do this now, it's going to be even worse and more unpleasant later, and that's our reason why. I also want to include here that a study found that more than half of adults in the United States over the age of 65 have sleep apnea or have a high risk for it. So again, there's a lot of people out there that have sleep apnea that don't know it, and it could potentially increase the risk of having cardiovascular disease by a factor of 3. So again, this is an example. Imagine you're overweight, you have a bad diet, you drink alcohol or smoke tobacco, you're stressed all the time, and you have sleep apnea, which is probably a lot of people out there. You're looking at probably a 2 to 10-fold increased risk of getting cardiovascular disease when you add those things up. And again, we're talking about the number one cause of death. So I don't think anyone wants to increase the number one cause of death by a factor of 10. Yet hopefully you can begin to see there's a lot of little subtle things that impact it that we have control over, a lot of people aren't doing. And again, that just kind of, again, goes on the concept that people have this feeling that as long as you don't do bad things, your health will be decent. So I don't use drugs, I don't binge drink alcohol, I don't smoke a pack a day, I don't weigh 500 pounds, so I should be okay, right? I should be fine. Sorry to tell you, but it doesn't work like that. As we get older, the body is prone to breaking down. We gave some examples just now about how as we age, the arteries get harder and it raises the blood pressure. So for a lot of examples, the body is prone to getting sick or ill as we age, which means we always have to be actively and proactively doing things to maintain our health. Doing nothing is not enough. Even if we can't notice anything, we always have to be doing more. So unless you're actively working towards your health, it's very likely it's getting worse. And a lot of these issues come from the effects of aging and lifestyle. So again, if we're not being proactive, we're accelerating our aging, we're not optimizing our lifestyle, a lot of bad things are going to happen here and they're preventable. So now we're going to talk about things that decrease blood pressure, which is generally the flip side. But there's some really cool and interesting points to be made here. So just in the list that I wrote them down, they're not in any specific order. If you improve your diet, and typically that's considered eating less salt, you can lower your blood pressure, the top number, by 2 to 5. So again, remember, we're trying to be around 120-ish. A lot of people are over 140, and our goal is to reduce by maybe 20. If we can go from 140 to 120, we're going to reduce the risk of cardiovascular disease by more than 50% typically. Diet is 2 to 5. Alcohol can raise your blood pressure by as much as 5 to 7 points. So if you stop drinking, you get that benefit. Exercise has been shown to alter blood pressure by 5 to 10. So you can lower it by 5 to 10. Stress, 5 to 10 is another one. Another important one is that for every 2 pounds you gain or lose, the blood pressure can go up by 1 point. So to give an example, if you go from 205 pounds to 185 pounds, you could probably expect to lower your blood pressure by 10. So that in itself could take you from 140 to 130 or 130 to 120. I think that's a really important point that people maybe miss out on. There's a lot of benefits of lowering your weight. This is a good example. Again, number one cause of death. And then smoking has been shown to increase the blood pressure by about 5. We also want to include if you don't take your medications or you don't take them properly, that obviously will impact it. And if you don't go to your doctor and aren't actively engaged in your health, that can be an issue. So I think what's interesting here is that none of those are a huge difference, although some of those can be as much as 10, which I would argue is a big difference. But if I take all of those and add them up, you get something between a 30 and 40% reduction in your blood pressure, which is huge. So you could go from potentially 160 to 130, 160 to 120, definitely can go 140 to 120. So if you can tweak your diet a little bit and cut out soda and junk food, if you can reduce your alcohol intake, if you can start going for a 20 or 30-minute walk every other day, if you can lose 5 or 10 pounds, find a way to manage your stress a little bit better, and quit smoking, if you're a smoker, you could potentially lower your blood pressure by 30 to 40 points, which is massive. There's basically no patient out there that a 30 or 40 point reduction would not take them from being dangerous to healthy. So again, I'll repeat that. This is the number one cause of death. Talk about dying. And we're worried about that as our issue, and we're trying to modify it. If you can change your diet, exercise a little bit, quit smoking and drinking excessively, you can probably go from being at a high risk to very little to no risk depending on where you go. Again, going from 170 to 140, 170 to 130, 160 to 130. So I think that's a crazy lesson that people just don't understand. There's little things happening. Your diet is a little bit, your exercise is a little bit, your stress is a little bit. All you have to do is fix and adjust those things, and it can be life-changing. It can save your life. So that's really the takeaway for today, is that do not wait to get this worse. And also you need to utilize the resources you have available today. And a lot of those are free and simple. So again, going back to the beginning, I hope you can understand that this is why we need to measure our blood pressure. This is why we need to exercise, and why we need to have a balanced diet and get our cholesterol measured once a year, because those 3 things are going to drive our health more than almost anything else. So my closing section here is that health is not a wait and see subject. And I get that all the time. Oh, it could be worse. I don't want to do anything now. I'm going to wait. Why would you wait? These things are going to get harder and harder to fix, harder and harder to reverse, harder and harder to treat. So let's just deal with it now. I would rather make a bunch of little, small, insignificant changes today than being forced to make a bunch of giant changes in the future, and that's what typically happens. Again, I want to say that most people typically don't really start working on their health until they have symptoms, but for most diseases, by the time you have symptoms, you've already progressed to being moderate or worse. So letting symptoms drive how serious you are, how concerned you are, you're setting yourself up for failure right there, especially with diabetes. It's a classic example of that. Instead of catching early on, you're going to catch it when it's moderate or severe, and the treatment options are going to be much more limited. I also want to include that for the most part, cardiovascular disease is fairly difficult to reverse. And for atherosclerosis, which is again when we have this buildup in our arteries, those plaques, when you look in the literature, the term you're going to see is partially reversible. It's not reversible. And the examples would be is if you use a statin can typically only reduce the size of those plaques by about 10%. And when you exercise, you can typically only reduce the plaques by about 10%. So when we talk about cutting down our diet, exercising, we're usually looking at a 30 to 40% increase of benefit or reduction of risk. But when we do statins for cholesterol, once we have them, we can only reduce it by 10%, which is why it's so important to take those things before we have a problem. They work really good when used early on. They don't work as good when it's too late. I think that's a really important message. We need to stop waiting for these symptoms to occur and being proactive, just going to the doctor, getting our labs done, being engaged in our health and understanding that my LDL went up, my A1C went up, my blood pressure went up, my BMI went up, and these things are bad. They're going to cause kidney disease, heart disease, cognitive disease, diabetes, and if I don't start being really aggressive in how I treat these things now, I'm not going to like what happens next. And again, it's much easier to give up lots of little things now versus in the future give up everything. So I'm not saying don't drink soda, don't drink alcohol, don't have that one cigarette, don't be lazy on Saturday nights on the couch. Just find some balance. Reduce it as much as you can and where you can. Versus if you wait 10 or 20 years, you will not be able to drink. You will not be able to smoke. You will not be able to eat fast food. There's going to be a lot of things you absolutely wouldn't want to do. You're going to have to give up or not be able to do in the future. So again, we're talking about cardiovascular disease. We're talking it both as a complication of diabetes to fit in our larger diabetes theme here at the podcast information the last month or so, but also the idea that cardiovascular disease is a very serious disease by itself. In fact, not only is it the number one cause of death with things like heart attacks and strokes, but it's been shown to basically increase the risk of 8 of the 10 other most common causes of death. Yet most people you talk to don't measure their blood pressure, don't exercise, and don't keep tabs on their health or their diet. And I don't understand why, because it's the number one cause of death, and these things have been shown to reduce it from happening. And so again, the goal for today is to give you that education, to help you understand how your body works, to give you that why, so you understand why you need to make these changes, to give you the tools you're gonna need in terms of signs, symptoms, how to measure your blood pressure, how to lower your blood pressure, and all that stuff. Hopefully you got a good takeaway out of that. If you like the channel, please subscribe and follow along. I think this is our 7th or 8th video in the diabetes series, so if you're interested in learning more, there's a bunch of other videos on the channel, check that out. If you have any questions, put those in the comments below. We have a lot of information on our website, which is yourpersonalpharmacy.net. And we also have our online supplement store. So if you're someone that likes supplements, but you're confused or not sure which brands or products are best for you, check that out. We have our pharmacist curated inventory. And you can also send me a message through email, set up a consultation. I'm more than happy to give you a 30-minute consultation to help you understand which supplements are best. Again, my name is Chris. I'm a biochemist and a pharmacist. I'm the helpful pharmacist. And I hope you guys definitely got a takeaway that you need to start measuring your blood pressure today, start exercising today, be more engaged in your health today. Because if you don't, you're not gonna like what happens tomorrow. Thank you.